Good morning, afternoon, or evening, everyone. We're from Group 5, and today we're going to present our final project for our first semester. But before we get started, I have a poem that I want to read. Birthday parties are a lot of fun. It can also be wild and free. Good morning, afternoon, or evening, everyone. We're here to present to you a topic about SUD. Okay, next slide, please. Okay, before we get into the topic, let us introduce ourselves. We are students from the Psychology Department of 11 Maret University, and we are currently in our first semester of college. As a psychology student, we learn about substance use and drug addiction. Thus, we have gathered and summarized information related to substance use and drug addiction. We are from Group 5, and the members are Niluh Arsa, Nur Fatimah, Raisa Ataya, me, Ryan Maulana, Regina Oftika, Ruth Mega, and Salsabila Amelia. Next slide, please. According to SAMHSA's National Survey on Drug Use and Health, 22.5 million people, or 8.5% of the US population, aged 12 or older, needed treatment for an illegal drug use or alcohol use problem in 2014. Only 4.2 million, or 18.5% of those who needed treatment, received any substance use treatment in the same year. Of these, about 2.6 million people received treatment at specialty treatment programs taught by CBHSQ in 2015. So, there are questions we need to answer, such as what do you know about substance use and addiction disorder? Do you think drug addiction can be the example of a substance use and addiction disorder? And do you wonder if people who have an addiction disorder will get treatment or maybe prevention? Next slide, please. To answer the questions, me and my colleagues will present about the danger of substance use and drug addiction. According to the American Psychiatric Association, drug addiction, also called substance use disorder or SUD, is a complex condition in which there is uncontrolled use of a substance despite harmful consequences. If we are aware of the symptoms, we must seek professional help to be diagnosed and treated. Not only that, but SUD can also be prevented. That is why it is important to know more about SUD. Next slide, please. Before we dive into the main topic, here are some previews about our presentation. First of all, we want to explain the definition, cause, and recognizing stages that may lead to addiction. Second, we are going to talk about common risks to who will get infected, diagnosis, and treatment. And third is prevention and how to seek help from substance use and addiction disorder. The next slide will be presented by my friends.
Okay, what is the definition of substance use and addiction disorder? Okay, before we go further, we need to know about what substance use and addiction disorder is. From the National Institute of Mental Health, substance use disorder or SUD is a mental disorder that affects person's brain and behavior. It also leads to a person's inability to control their use substance, such as legal or illegal drugs, alcohol, tobacco, or medications. The symptoms can range from moderate to severe, with addiction being the most severe from SUDs. The most severe SUDs are sometimes called addictions. Anyway, we are going to use SUD rather than substance use disorder during this presentation. Individuals who experience SUD during their lives might also experience occurring mental disorders such as anxiety disorders, personality disorders, schizophrenia disorders, bipolar disorders. People with SUD might have disturbed thinking and behavior. How could it be possible? It is possible because SUD changes the brain structure and function that relates to judgment, decision making, learning memory, and behavioral control. Okay, next slide, please. Uh, the cause of substance use and addiction disorder. Just like any other disease, SUD currently has causes. Next, we will explain about the causes of SUD. Is there anyone who know about the causes of SUD? Actually, the exact cause of SUD is still unknown. But from Nystrom and associated websites, Genius, the action of the drug, peer pressure, emotional distress, anxiety, depression, and environmental stress can all be factors. By Genius, once someone has started using a drug, the development into addiction may be influenced by inherent traits which might delay or speed up this disease progression. According to the National Library of Medicine, children who grow up seeing their parents using drugs may have a high risk of developing substance use problems later in life for both environmental and genetic reasons. In society, people with developed substance use problem usually have a depression, attention deficit disorder, PTSD, low self-esteem, even a stressful or chaotic lifestyle. Okay, next slide, please.
Now you wonder how we recognize the stages that may lead to SUD. Usually, people who use substance use don't reach addiction levels right away. Substance users usually have high curiosity in the first place. According to Nystrom and Associate website, there are 4 stages that may lead to addiction. First of course, experimental use. It typically involves peers, recreational purpose, user who enjoys defying parents or other authority figures. Second is regular use. Usually, user use drugs to fix negative feelings and cause worry about losing drug source. User in this stage begin to stay away from family and friends, misses school or work, and show increased tolerance and ability to handle the drugs. The third stage is problem or risky use. User in this stage already lose any motivation, thinking drug use is more important than all other interests, having obvious behavior change, and begins to think that drugs help support habits. And the last, or the fourth, the top of this stage is addiction. User cannot face daily life without drugs. Physical condition get worse, loss of control over use, financial and legal problems get worse, and may have broken ties with family, friends, or members. After going through our while in the 4 stages mentioned earlier, drug use certainly feel the effect of its use. As we know, drugs have a high risk to the physical and physiological user. According to Substance Abuse and Mental Health Service Administration in general, the risk of getting SUD include first, for someone who's over 18, is a serious mental illness is defined by having a diagnosal mental behavior or emotional disorder. This causes serious functional impairment that substantially interferes with or limit one or more measure of activity. Second, users under 18 also have diagnosed mental behavior or emotional disorder in the past year, which result in functional impairment that substantially interferes with or limits the child role function in family, school, or community activities. And the last is substance use disorder occur when the recurrent use of alcohol and or drugs cause clinically insignificant impairment, including health problems, disability, failure to meet major responsibility work, school, or home. Next. And the next is going to explain by my friend.
Okay, thank you, Chacha. Next, we are going to discuss about the diagnosis and treatment of SUD. You guys are maybe wondering how mental health professionals diagnose and give treatment to SED users, aren't you? Have any of you heard about it? While substance use dependency can be a frightening reality to confront, it's important to keep in mind that all types of substance use are treatable with the right plan in place. Actually, there are a lot of ways to treat SUD users. In this section, we're moving to diagnosis and treatment of substance use and addiction disorder. Now let's turn to diagnosis of SUD first. SUD users may find professional mental health, such as a psychiatrist, psychologist, or licensed alcohol and drug counselor to do evaluation that often includes assessments. Blood, urine, and other lab tests are used to assess drug use. We have to highlight that they're not a diagnostic test for addiction. They can only establish the nature and level of drug use. However, these tests may be used for monitoring treatment and recovery. A toxicology test or screening may check up for up to 30 different drugs at once. This may include prescription drugs, non-prescription drugs, and illegal drugs such as cocaine and heroin. During this time, most mental health professionals use criteria in the Diagnostic and Statistical Manual of Mental Disorder or DSM-5 by American Psychiatric Association for Diagnosis SUD. Okay, now you may be wondering, is there any treatment for SUD users? The treatment itself, we must keep in mind that there is no cure for drug addiction. Treat- Treatment options only help SUD users to overcome an addiction and stay drug free. The treatment depends on the drug use and any related medical or mental health disorder they might have. Treatment programs for SUDs users usually offer individual or group therapy and family therapy, a focus on understanding the nature of addiction for becoming drug free and preventing relapse, and levels of care and settings that vary depending on their needs. Other treatments are withdrawal therapy, opioid overdose using medicine, behavior therapy, self help group, and ongoing treatment. The next will be presenting by my friend.
Okay, so our next topic is the prevention of substance use and addiction disorder. Next slide, please. Okay, substance use and addiction disorder are increasingly prevalent in society. However, there are some people who still don't know how to prevent it and ask for help when to contact a medical professional. What can be done and what can be done? Therefore, let's learn how to prevent it before it's too late and it gets worse, such as finding out what drugs are and their negative impact on body's health. Choose a good social environment, do various positive activities such as studying or exercising. Use free time to relax with family, study, exercise, or do other positive activities. Next slide, please. How to seek help and when to contact a medical professional. As we have discussed, substance use and addiction disorder can be prevented. We can also ask for a professional help. According to International Society of Substance Use Professionals, here are the prevention services provided in Indonesia. The first one, government unit responsible for the prevention of drug use disorders only. The second one, budget line in annual budget of government for prevention of drug use disorder only. The third one, federal government is the most important financial source for prevention services in SUD. Sorry, for SUD. The fourth one, prevention services available via mass media channels, school-based programs, and community-based programs. And the last one, presence of a community-based needle exchange program. Next slide, please. As written in the Cleveland Clinic website, We ought to get medical care as soon as we have signs of substance use disorder, such as confusion, neglecting to eat, withdrawing from friends and family, sudden changes in mood and behavior, taking a substance in large amount and for a longer amount of time than you're meant to if it's a prescription, having a strong desire or urge to use the substance, having unsuccessful effort to cut down on or control substance use, having issues fulfilling responsibilities at work, school, or home due to substance use, and many other. Now, the next slide will be explained by my friend.
Alright, so the next is I will sorry. Alright, so the next is I will explain about how can we help people with SUD, the do and the don't. Next, please. I will explain about the do first. From American Psychiatric Association, there are some suggestions we can do to help our beloved one and ourselves. First, we can learn about alcohol and drug misuse and addiction. Second, speak up and offer support. We can talk to our family or friends about our concern and offer our help and support without being judgmental, including our willingness to go with them and get help by calling a helpline, talking to a healthcare provider, or a mental health professional. Third, we can express love and concern. We must prepare to respond with specific examples of behavior that has us worried. And then, fourth, we also can practice empathy because when we don't agree with our loved one, listen thoughtfully to them. The more they feel hurt, the more they see us as someone they can trust. Next, please. Inside of the Do, adapted from National Council on Alcoholism and Drug Dependency, there are also things we don't want to do. The first is don't cover up, lie, or make excuse for his or her behavior. Second, and don't assume their responsibilities. If we take over their responsibilities, it protects them from the consequences of their behavior. Third, don't argue with them when they are using alcohol or drugs. At this point, he or she can have a rational conversation. The next done is don't feel guilty or responsible for their behavior because it's not our fault. And the last is the most important thing for us is don't join them and don't try to keep up with them by drinking or using. The next will be presented by my friend.
So, the next is conclusion. After we discussed SUD back then, we almost reached the end of the presentation. It's time for us to sum up our topic. Back to the data we said back then, we already know more about substance use and addiction disorder. We are pretty sure none of us want to be part of that data, aren't we? So from now on, if you think you have the same symptoms, please don't be self-diagnosed. You should consult to a psychology or psychiatry. After we got to know more about substance use and addiction disorder, we already know how bad it is for our body and mind. So from now on, we have to be more aware by never trying that kind of thing even once, and we can also help or build up and to get out from the cycle. From our presentation, we can conclude that drug addiction and substance use disorder, or SUD, is a complex condition in which there is uncontrolled use of a substance despite harmful consequences. If we are aware of the symptoms, we must seek professional help to be diagnosed and treated. Not only that, but SUD can also be prevented. That is why it is important to know more about SUD. Last, we will leave you with the words from Calvert. Though no one can go back and make a brand new start, anyone can start from now and make a brand new ending. That's all for our presentation. We hope it brings all of us new insight. Always remember that it's okay to ask for help. Thank you, everyone, and see you soon.